topic is I am a monster. A very good afternoon, fellow Toastmasters and guests. So, here is a question. How many of you look in the mirror every morning? Do you feel good or do you focus on your imperfections?
Good.
Second one. Okay.
Good.
Good. Okay. So here is why. Britain's Danny Bowman spent 10 hours a day and took about 200 selfies on a daily basis. He didn't leave his house for 6 months due to his obsession over personal appearance. Mr. Bowman has been diagnosed with body dysmorphic disorder. The acronym for this disease is BDD. BDD is an obsessive preoccupation with some aspects of one's own appearance. They obsess that it's severely flawed, and that individual takes exceptional measures to hide or fix it. In BDD, the flaw is either imagined or if it is actual, its importance is blown out of proportion. This disease was first described by Italian psychiatrist Enrico Morselli as dysmorphophobia in 1891, and over the years it was termed as body dysmorphic disorder. BDD usually develops in adolescence when people are vulnerable about their personal appearance, and in most cases it takes about 15 years for the person affected to realize that he has got BDD and to seek appropriate help. And even when they do, they present it with other symptoms like depression or social anxiety. And in most cases, they don't reveal their real issues. BDD is often considered as a closet disorder. Any guess what would be the major areas of concerns? They obsess about having acne, marks, scars, going bald, having facial hair, or even the size of their nose. Sometimes it's even about the overall body build. Some agonize about 5-6 parts of their body, or some just with one. But the agony is the same. The negative thoughts like, I look ugly, I look terrible, are intrusive and obsessive, and are always difficult to control or resist. That's why it's called a disorder and different from the normal thoughts of disliked appearance, disliked aspects of appearance. They would have delusions. Why is he looking at my nose? Do I look like a monster? This could be one such delusion. If you find someone regularly checking their appearance on mirror, feeling their skin by touching it, camouflaging their appearance, or staying away from all the public or social gatherings, and staying housebound, you might have well spotted a BDD sufferer. According to the statistics, BDD patients are 45 times more suicidal than normal people. Diana, an American woman who suffers from BDD, explained in a talk show that she was housebound for 2 years. She said she feels ugly and monstrous, and that feeling that her eyes would bulge out. She always wears a hat to feel secure. She had undergone 50 to 100 permanent makeup procedures. She has done her eyebrows, lips. She has even got an eyeliner tattoo. Even after getting all that procedures done, she isn't satisfied. She feels that all these procedures have deformed her when it really hasn't, and tries to conceal it with doing a makeover. She has attempted suicide 4 times. And what causes this BDD? Sadly, the causes are unknown, but it could be likely due to various combinations like genetic factors, certain stressing moments like bullying, teasing, or abuse, which would have made that person more vulnerable. And there is this certain part of of the brain that is overactive in BDD patients. It's called obsessive circuit in the brain. And according to Mr. K. Raman, a psychiatrist of Sri Ramachandra University, patients, the BDD affected rates are from 7 to 15% in patients seeking cosmetic surgeries, and to about 12% in patients seeking dermatological help. And most often when the BDD sufferer goes for a cosmetic surgery, it really doesn't help, and they feel that it hasn't changed anything about it, and in most cases they feel that it has worsened the obsessive part. And believe it or not, Catherine Phillips, an expert in BDD, advises, do not try to tell them, no, you actually look gorgeous. You will soon have one friend less. Instead, if you have the guts, tell her that she has got BDD. And if you find the cues of BDD in her, introduce her to medication and cognitive behavioral therapy, specially structured for BDD. It's a talking therapy program which can help you manage and cope with how you, by changing the way you think and behave. Someday, the perceived monster in her sight might vanish. Thank you. Thank you to you.